Good day, Professor Kan, and to all our professors. My name is Fernando Lee, and I am a student of the Masters of Information System. Today, I'm going to present to you my final capstone project, the one that is running on this mobile device, and the one that is running on the web. On the next slide, I'm going to present a more detailed feature of my project.
My capstone project is entitled Health-Assist. It's a patient case management system designed for Brightcare Philippines Incorporated. We all know that before this pandemic, the Philippine medical tourism industry is one of the booming industry in our country. And in fact, there are several medical assistance companies that are emerging because of this demand. And one of these is the Brightcare Philippines Incorporated. Their company office is located in Makati City. For this presentation, I'm using the following outline. First is we'll discuss the problem, then the background and the project objective, the solution proposal, the implementation details, and then I'll do a system demonstration. Then we'll discuss the project assessment, the conclusion, the recommendation, and then the future of this project. The project is designed as a web application, but there is also a small mobile app to support the system. Now, let's start with the problem statement. We have four major problems that we are going to resolve. First is managing the patient record and patient encounter. Patient encounters, these are the patient visits or the patient consultation with the doctor. Now, next is we're going to resolve the communication between the patients and the Brightcare staff. Then next is keeping of reference documents. Basically, we will just organize the uploading of the attachments or attached documents. The next one is the monitoring of invoices and remittances. So monitoring, we will make sure that there's no double billing or double invoices, and the payment is also reflected properly on the invoices.
Next, we're going to discuss the background and the project objective. Initially, this project started with a simple talk to Ms. Myra Tacorda, the Chief Executive Officer of Brightcare Philippines Incorporated. The Philippine medical tourism is a booming industry, and according to the Medical Tourism Association, Philippines ranked 8th among the top country destination for medical services. And because of that, there's a need for a third-party administrator between the international insurance companies and the healthcare facilities. And this third-party administrator are what we call the assistance company or the medical assistance company. And one of these is Brightcare Philippines. Now, international insurance providers, they prefer to communicate assistance company rather than going one by one to the healthcare facility that their client or their insurance member has been diagnosed. So this assistance company will assist the clients or the insurance members that are seeking medical attention. This assistance company are the one doing arranging the doctor's appointment, looking for the specialist, and then they're also the one organizing the medical expenses during this insurance member while this insurance member is being diagnosed in the Philippines. So there are several cases that the insurance member are going to a different clinics or hospital, not only one hospital but multiple hospitals. So for our project objective, we are going to automate the case management monitoring process. Currently, the Brightcare is using Excel and share it to their staff to monitor their patient cases. But it would be hard because sometimes the Excel are not properly updated, so it looks like a manual process for now. So that's one of our objective, that we want this application to automate the current manual process. And then the second objective is to provide a convenient tool, convenient communication tool for patients. It is one of the reasons that we designed the mobile app, the mobile application that will support this the patient users. The third objective is we are going to design a hybrid system. It will work as a mobile app and a web app. Well, initially, I mean, the project itself is actually a web application. This mobile app is only a supporting application that will work with the mobile application. And the last one, of course, our objective is to support further this medical tourism industry.
Okay, I am demonstrating to you now my project, which is the Health Assist, patient case management system designed for Brightcare Philippines Incorporated. I identified 5 types of users. We have physicians, and the patients, the insurance providers or the international insurance companies, the staff users, and then we have the admin user. So only the admin user has the right to create or register a user. So we don't have a sign up a module for our system. And also only the patient user have the access to the mobile app of the Health Assist. The rest of the user will be using this web application. Okay, I will just show you the staff user. Actually, the staff user can do. We have the patients module, service requests. These service requests are all the requests coming from the patient or the insurance providers will be shown here. Then messages. In our mobile version, there's messaging feature in which all the messages will come to this page. Then we have the patient registration. This is where we register the patient. And then the patient appointments. This is where we monitor all the appointments for the patients and their corresponding physicians. Then we have the patient encounters. Patient encounters are actually visits, patient visits or patient consultations. And then we have the patient case. This is the main transaction. And then we have the patient invoices and the remittance. Okay, I will just show you the straightforward transaction from the beginning of the patient case to the closing of the patient case. So this login as a staff users can do everything. So start with registering a patient. So created a patient, you can start creating a case. So to create a case, you just click case, and then you need to just save. It will generate the case number. So once you have the case, you can go here and then you can create the appointment. Create a doctor's appointment. So say this type of appointment, and you need to select the doctor and then save. So once it's saved, you can create an encounter from this appointment. So, I mean, during the appointment day, the staff can do this creation of new encounter. So, new encounter means a new visit to the doctor. And then save and send. Or you can also, I mean, the staff can also do initial assessment so that when the doctor see the patient, I mean, open the patient's file, he can view this initial assessment. So, let's say. By the way, the Brightcare staff, some staff of the Brightcares are also nurses, so they can do this kind of medical assessment. Just log in as a doctor. As you can see, this patient here will appear on the doctor's list of patients. So if the doctor wanted to start the consultation, just click this green button, and then the doctor can do his assessment to the patient. On this form, this is the actual visit form. The doctor will just, if he wanna see the data representation, you can just expand this and minimize this one. So he can do a diagnosis from here. Let's say so if it's not here, the doctor can also do typing. So he can add more multiple diagnoses. And then also the design is like a medical chart. Like this one is subjective. They can enter what's the complaint, what are the historical illness, history of the present illness, the review of system, maybe physical appearance. Then we have this past medical, social. This is kind of assessment, assessment of the doctor. And then, as you can see here, this is the one that the Brightcare staff entered. So the doctor can also see this one. And then this one is the disposition. This is the initial list that they gave us. So, and then they will provide if they want to recommend for a rest day, if they want to provide restrictions of work or here. So once the doctor is done, you need to save and complete the form. So once it's complete, it will disappear on this active list. It will go to the archives. And it will show here completed. So when we will go back to the staff login. We'll see the completed encounter. Let's go to the case. This is the case. As you can see here, the status is completed. If there's no need for the patient to undergo more patient visits for this case, they can add invoices and then close this case. So invoices will be added by the Brightcare staff. Let's say clinic charges. By the way, as you can see, the reference document is also here. So for the case, you can attach medical cases, medical form coming from the doctor, like for example, medical certificate or something. You can attach it here, so it will just save. And then if they wanna close this, you just save it complete. So once it's complete, the status will be closed. And then the invoice will be shown here. You open this, you can see the detail. So once it's closed, here in the remittance, you have to select the insurance name, and then they will select which invoice going to pay. You can see here it's the total 5,000 based on these charges that we entered. Just pay. They can also attach again on this form. You can attach a document. Save and post. So basically that's the end. So if the patient wanted to get a medical certificate, he will just open this encounter. We have this form here, play prescription. Sometimes they need to print a prescription and give it to the pharmacist. We have this also printing of prescription. And we have used medical certificate. They can save this into PDF and send it to the patient. Now I'm going to show you now the insurance provider's login. So I'll log in as insurance provider. So the view of the insurance provider is this. And they have this, they can create a request, a service request. They can view their patients. By the way, only the Brightcare staff can register a patient. So if the insurer will create a request, they can do the date, prepare date. You can have outpatient, and then you have to select the patient name. Say this one. Then they can provide remarks, and again we have this reference document module. I mean the document management module here, that they can attach any document and then save or submit. So once it's submitted, it will show the status here. And then when we log in as the Brightcare staff, we can see the service request here on the service request. And you can see it here. And then we can open it. And then we can approve or cancel. So, but before we approve, we need to assign a doctor. So we'll just assign the same doctor because this one, I created a user account for this doctor. We can just demonstrate. Again, on this module, we have this document management. Then click approve. So once it's approved, it will generate a case number. So when we go to this case, patient cases, as you can see, this one, it's been created. When you open the detail, it will also show that there's an appointment created, and then for this doctor. If you open this, you can create an encounter from this. So it's the same process. Like it's the same process. The only thing is the request was first created by the insurance provider. So create encounter. Now for the admin user can view all information that needs to be shown. As you can see here, we have 7 active cases. This is the dashboard of the admin, and it will show the detail here. And then you can also see the list of clients, can add clients, the list of physicians. So I'm now going to show you a demo for the mobile app. The mobile app is only intended for the patient. This is only used for communicating between the patient and the Brightcare staff. The mobile app is only a small app. That's the purpose only is to have the patient be able to create a request using the mobile app. Appointment request, and then they can also send messages to the Brightcare staff. So it's plugged in. So the username must be a registered patient so that it will show the profile of the patient to the patient registration. It should match. Now, since this is sponsored by Brightcare, so the first page, I decided to create an advertisement page for the Brightcare. But the main functionality for this app is to let the user search for a doctor or the specialty. It's a neuro doctor. They can select the date, preferred date, then message, submit. So that's it. So once submitted, it will also show on the appointment list all the appointments will be shown here. Now, when the staff logs in, it will show to the under the service request module. It will show now the new request. This status is pending. So we can open it. Now, sometimes the staff will call and ask for some documents required for this request in order to approve. So we put here another functionality for the documents management module. You can attach appointment here or maybe an authorization. Usually it's an authorization, so that will be approved. So again, during the appointment day, the Brightcare staff will create an encounter, and then if they need to change the doctor, you can still change the doctor here. We're going to discuss the project assessment. I categorize the project assessment into 4 different types of testing. First, the functional testing, stability testing, stress testing, and last one is the security testing. For the functional testing, I created a series of functions and let the user test it based on the function, if it is working or not working. So on this screenshot, which is example, the more detailed result of the functional testing is on the manuscript. But overall, it's a pass. The usability testing, I created the following questionnaire and let the user answer this according to their evaluation. And based on this formula, it scores at around 90%. Still belong to excellent rating. Performance testing, I use a Blaze meter to measure, to do the performance test. Blaze meter is an online testing tool. So since I only have free account, so I can only simulate up to 50 users. But if you can observe on the 20 user, there's only 4 throughput hits per second, and then 5.46 average response time. But when we increase to 50, the throughput is also increases, as well as the response time also increases. But since this is measured in seconds, so I think the system still perform accordingly. The system is hosted in AWS, so using their RDS or the relational database service of the AWS. And the last one is the security testing. So I don't have a tool to do the security testing, but I make sure that I'm using, there is an encryption on creating a new user account. I use a symmetric algorithm for the encryption. Even if you are a database administrator, even if you can open the users table, you cannot view the password because it's encrypted. So to conclude, Health Assist provide a simple solution to automate the case management processing for Brightcare. It captures the detailed medical patient records, as you can see on the demo. It simplifies the invoices and remittance monitoring. Although the invoicing and remittance are not very detailed, but it's enough information for Brightcare to process. And then organize reference documents. As you can see, each forms or pages have their own document storage. So it's organized. Provide a convenient communication tool for patients. The use of messaging with the mobile device will definitely help improve the communication for patients, especially those that don't have, especially if they're traveling in the Philippines from another island. These are the recommendations for the system. First is conduct more research on the business process of other assistance company. I'm thinking to make this system into a common system for assistance companies. So having more research on another assistance company would be good to address. Then the second is the system security. Of course, we're handling patient information, so we need to make sure that our data is secure enough. The third one is the video and audio integration for the mobile app. I have a good response on the mobile app, and they wanted to make this into something like a telehealth, a teleconsultation. So they can easily, from the mobile app, they can connect directly to their doctor, or the doctor can communicate directly to the patient. And the last one is the enhance or change the user interface, make it more user-friendly. So as you can see, the design of the user interface is basic enough to, for our future work. Brightcare actually offered to sponsor the project and make it into production, and they are willing to pay the Amazon services and other things that need in order for the system to run, so that they can use it in their own organization. So if it will push through, I will do a market research and feasibility study to register Health Assist as a product. I think there's a potential for this system to become to be useful to another assistance company. The next one is improve the mobile app feature to compete with telehealth application. So again, if there is a sponsor for this, will push through with that feature. And the last one is help definitely find technology partner, because working alone is not enough to make a good product. So that's it. And I would like to thank you, everyone, for this demonstration, and have a good day ahead.